Hi, my name is Dr. Benjamin Chu. I'm a plastic surgeon here in Honolulu, Hawaii, and I've been practicing at the Queens Medical Center for 22 years. To you a little bit about Asian rhinoplasties. Here in Hawaii, we have a predominantly Asian population, and doing Asian rhinoplasties is quite different than doing a Caucasian rhinoplasty or a rhinoplasty on an African American person. So let's start with some basics here. In many Asian um, patients, they want their bridge higher. Many want it higher, but not as high as a Caucasian rhinoplasty. So there's a perfect balance, and we'll go over this in just a minute by looking at some photos. Now, in most Asian countries, they will augment the Asian nose with what we call an L-shaped silicone implant. Now, this can be problematic because as you go much higher, especially to the tip, you will stretch your skin too much, and in certain unfortunate cases, this part of the implant can actually extrude or even push their way through the skin. So what I prefer is using this particular type of implant. It's called a Rizal nasal implant. And you only make, this is the top, this is the tip, and you go up to the tip, but this does not actually reach the tip. And you can see it comes in many, many different sizes, from an extra small to a small to a medium to a large, and there's one extra that's extra large. Okay, let's look at some before and after photos and try to analyze what we want to accomplish when we do a Asian rhinoplasty. Okay, let's look at some before and after and try to analyze what would be the goals of an Asian aesthetic rhinoplasty. If you look at this gal here, she's a rather attractive woman who's got, in her opinion, adequate bridge height. So she did not really desire the bridge to be much higher. What I consider adequate bridge height on an Asian person is this little curved part starts roughly about the mid-pupil level. But however, if you look at her tip, she doesn't really have a tip that's really well defined. We'd like to see this tip at least 2 millimeters higher than her bridge. She also has a bit of a weak chin and a little bit of extra excess fat under her neck. Now, let's look at her photo here as an after result. You see here the tip height is slightly higher than the bridge. Her chin has come forward with the aid of a small chin implant, and her extra fat that she had has been suctioned away. And if you look at her profile here, her face is in much better harmony, therefore she is a much more attractive looking individual in this picture. From the front, I mean, basically you could see her nose looks reasonably high enough. You know, her chin, it's difficult to tell that it's a little on the weak side. However, from her after, you know, she has a very natural look. She does not look like she has been operated on. She just looks more refreshed. The tip is more refined. You can see we narrowed her nostrils ever so slightly, but not making it look pinchy. And her chin looks a little bit more defined. So overall, I mean, a nice result would be one that looks natural, that an individual cannot tell that you've had plastic surgery. From the front, I mean, basically you could see her nose looks reasonably high enough. You know, her chin, it's difficult to tell that it's a little on the weak side. However, from her after, you know, she has a very natural look. She does not look like she has been operated on. She just looks more refreshed. The tip is more refined. You can see we narrowed her nostrils ever so slightly, but not making it look pinchy. And her chin looks a little bit more defined. So overall, I mean, a nice result would be one that looks natural, that an individual cannot tell that you've had plastic surgery. See the same individual from the front. From the front, I mean, basically you could see her nose looks reasonably high enough. You know, her chin, it's difficult to tell that it's a little on the weak side. However, from her after, you know, she has a very natural look. She does not look like she has been operated on. She just looks more refreshed. The tip is more refined. You can see we narrowed her nostrils ever so slightly, but not making it look pinchy. And her chin looks a little bit more defined. So overall, I mean, a nice result would be one that looks natural, that an individual cannot tell that you've had plastic surgery. Let's look at a second individual here. This person is mostly Asian, little bit of Filipino. She has relatively low brow, a bit of a prominent forehead, reasonably shaped face, but you can see here after having an augmentation rhinoplasty where we put that nasal implant from here only short of the tip and then created the tip using ear cartilage, she has an extremely natural but more attractive appearance. Let's take a look at her from the side. You can see she had almost like a saddle kind of nose, very, very low. If you were to look at the curvature where it started, probably well below her lower eyelid region. And as we mentioned before, we'd like it to be roughly about the mid-pupil level. Her tip is slightly higher than the bridge. She didn't need a chin implant. She already had a very nice chin. We did smooth out the bony part of her forehead, and now it's given her a much more softer, feminine appearance. Again, balancing the aesthetics of the face. Okay, let's look at a third example. This is a young Asian woman who desired to have a slightly higher bridge and better facial aesthetics. Now from the front, it's difficult to see that really she's had a major change. She had a slight augmentation of the nose and the tip, and you can see her nostrils are a little bit smaller. But where you're going to see the major difference would be from the side. Here, you know, you can see she has a reasonably decent bridge, but you can see it's kind of that curvature starts somewhere near the lower eyelid. We'd like it to be preferably around the mid-pupil level. Her tip was lacking projection. She had a weak chin and a little bit of excess submental fat. And now you can see with the use of the smallest implant, which is an extra small Rizal, a tip was increased using her ear cartilage, as well as adding a columella cartilage graft here. The shape of the nose is much improved. The fact that the chin has moved forward has balanced her lips. It doesn't look like it jets out as much. And then her jawline looks much more refined and clean without this excess submental fat. Okay, so let's summarize how we do Asian rhinoplasties. I like to use a dorsal silicone implant that goes from the here down to the tip, but not to the very tip, adding only ear cartilage to reshape and resculpture the tip, and then try to balance the facial aesthetics with the use of either a chin implant and or a liposuction of the neck. This procedure is not very painful. That's number one. Number two, it takes about an hour and a half to do. And the recovery time is approximately 1 to 2 weeks. Thanks. This is Dr. Benjamin Chu from Honolulu, Hawaii, giving you an explanation on Asian rhinoplasty.